Hello, this is Perth Chiropractor Dr. Lazar Jancic, and in this video I'm going to be covering something called cervical radiculopathy, which is a condition I see a lot in clinic and get great results with. It's basically a technical term for pinched nerve in your neck, causing all sorts of funky symptoms down your arms, including pins and needles, numbness, weakness, heaviness, loss of coordination, loss of strength, and so forth. Specifically in this video, I'm going to cover 3 common mistakes I find people make during a bout of radiculopathy, cervical radiculopathy. On top of that, I'm going to give you 4 steps that you can take to immediately move towards resolution of this problem naturally. So listen up. So how do you know whether you have cervical radiculopathy? There are different conditions which will cause pain and funny symptoms down the arms, but a simple way to know that you have a bulging disc causing the radiculopathy is if you put your neck backwards like this, and if that alone causes an aggravation of the symptoms in your hand, you'll know that you probably have, or the chances are high that you have a bulging disc in your neck. If the symptoms are in your right hand, try this. If you extend backwards and at the same time tilt to the right, again, if that exacerbates your symptoms, back off immediately, get out of that position. You don't want to stay there for long, but you will know that you have this cervical radiculopathy. This is quite a serious condition. It's not to be messed around with. Unfortunately, it often does progressively decline, and it can be quite frightening. People don't know what to do, and some of the other options are basically surgery. So if you're looking down the barrel of surgery, it can be quite intimidating. And on top of that, if you don't do anything about it, these effects can become permanent, leading to permanent loss of strength and coordination in your hands, which is doesn't sound very nice. So the good news is that this condition can be managed naturally. I see these conditions all the time in my clinic, and you can almost within minutes start to improve your condition if you follow my instructions and reduce that cervical radiculopathy completely naturally. So here we go. Here are my 3 common mistakes that people make during a bout of cervical radiculopathy. Number 1 is taking painkillers for a variety of reasons. Painkillers, if they even work, if they work by reducing some of your aches and pains, they will numb your pain, and you can actually do more harm than good because you don't realize that you're making it worse. So that's one big reason. Also, they do nothing for the underlying condition. They don't address why you have a bulging disc in your neck. So I don't really recommend that as a first line of approach. Mistake number 2 is people don't move. Really, the underlying problem here is a lack of movement for the disc, and because there's often pain associated with some of these neck movements, people get very frightened and they become guarded, and they limit their movement, which is pretty much the opposite to what you should be doing. So that's mistake number 2. Mistake number 3 is people wait and they don't do anything about it. This is almost a sure way to worsen your condition, certainly the underlying condition, and have more and more problems following. So let's talk about 4 steps that you can take immediately to reduce these symptoms and move towards resolution naturally. Number 1, I often tell this to people, is not to panic. there's a very high chance that this will calm down rather quickly if you follow these steps. So step number 1 is don't panic. Number 2 is you need to start to introduce very gentle movement into your neck. Be sure to be guided by your pain and your symptoms in your arm and your hands. The movements are very simple, but it's the repetition that's quite important and consistency throughout the day. So I'm just going to do a little demonstration now, but basically it's moving your neck backwards, almost as far as you can comfortably, but you don't want to linger in that position. Forwards and backwards. I would do this 5 to 10 times, like so. You can also throw in a little bit of side to side. Remember, if your symptoms are in the right hand, the right side will probably be a little bit more painful. The key is not to linger in that position. It may temporarily make the symptoms a little bit worse, but in many circumstances, just by doing these stretches, your symptoms in your hand can almost instantly start to reduce. One more point with the stretching, make sure you go back as far as you can. I often find people doing this, but that's not enough. You can really go much further backwards. Okay, as long as you're not getting sharp stabbing pain, a little bit of discomfort is okay, but you must move. The disc really needs it, and it will help rapidly resolve your condition. Step number 3 that you can do is to be aware of your posture. A poor posture is often what leads to disc problems in the first place. I'm talking about those rounded shoulders and forward head carriage. That puts an incredible amount of pressure on your cervical, your neck discs, and will certainly contribute to your problem. Step number 4 is seeing a chiropractor. The first 3 steps I recommended will probably give you significant improvement and maybe even resolve a lot of your symptomatic pain. But to truly address the underlying problem, I strongly recommend people see a chiropractor that knows and is familiar with this condition. There's numerous studies which show the benefits of chiropractic, and this particular study, which I'll reference later, it certainly showed that chiropractic had better and longer lasting results than medication use. And also, chiropractic has been shown to reduce chronic neck pain by over 75% in many circumstances. So, and again, as I often tell people, chiropractic is completely natural. So take advantage of these positive effects to help your cervical radiculopathy. Thank you for listening to this video. My name is Dr. Lazar Jancic, and if you have found this information helpful, please like and comment, and feel free to share this video with others. This is quite a troubling condition, and many people could benefit from this information. So feel free to share, and until next time, this is Perth Chiropractor, Dr. Lazar Jancic.